Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Urbana Public Health District, Julie Pryde. Hi, Julie.
Hi, how are you doing?
I'm doing okay. I have a lot of questions for you, as I always do, but let's start with the fact that coronavirus hospitalizations hit another record nationally. Experts warn that Thanksgiving gatherings worsened the pandemic. When will we start to see a spike in cases?
Well, we're going to start seeing probably a spike in cases by the end of this week. And then within the next 2 to 3 weeks, we're going to see the increase in hospitalizations and then deaths around that time, 3 weeks on, is where we will likely see the cases increase and the hospitalizations and deaths.
Over the Thanksgiving holiday, the traveling was down a third of what it usually is, but we still had 1.6 million people moving through the airports against the advice of health professionals. What can we do? I'm exasperated to ask you, how do you continue to get the message out? This is not okay.
Well, clearly I don't know, because I've been saying the same thing practically now since about March. But unfortunately, some people just aren't going to take this seriously unless it affects them. And that's a hard way to learn a lesson. And I don't want people to have to go through that. But unfortunately, I think that some people just are not going to, follow the mitigation. They may have done great for, 9 months, and then, you get towards Thanksgiving and Christmas. We cannot let our guard down, because we're getting close to, the promise of a vaccine. So we have got to be careful, not only for our own selves, but our families and our community as well, because the cases it's going to be a rough winter. No matter vaccine or no vaccine, it's going to be a rough couple of months.
We are going to get into vaccine distribution and Christmas assembling, but first, can we go through the numbers here in Champaign County with local cases recovered, current, and hospitalizations?
Sure. So right now we have 924 active cases. That's people in isolation. We have 17 Champaign County residents hospitalized right now, although the hospitals are definitely getting full. We have had 58 deaths. And what's really concerning about that is around 30 of those, I believe, have been in November. So November has been a very, very rough month. And right now we have 1,646 people in quarantine. Good news is our county's positivity rate right now is down to 6.9, which is definitely headed in the right direction. That makes us happy. We do know, however, that we're getting ready to, slingshot back because of the Thanksgiving gatherings. And our region is at 12% right now. So, we're moving in the right direction, which is good. I'm glad that we're not, still headed that way as we hit the Thanksgiving cases, because like I said, we know those are going to be high. But after, so at least we know that the mitigations are working and that people are, have been being careful. And, if we're lucky, a lot of this will hold through Thanksgiving, but it's not looking that good.
Let's go back to the vaccination prospects. So this is something that we're working on. The FDA is looking to certify Moderna and some of the other companies working on it. The big question everyone wants to know, how are we distributing this? Who gets it first? When are we getting it? Do you have some of those answers?
Well, I have the draft of those answers, so I'm going to go over this real quick. This is from the National Academy of Sciences, and they have put together an amazing panel to look through the vaccine distribution issues, looking at it going historically, how things have gone on other community vaccination events, as well as looking at it through a equity lens and looking at it through who this particular vaccine seems to be the most deadly and consequential for. So we have, first of all, phase 1, which we hope will start, in the middle of December when the vaccine first arrives. It will go, it's called the jumpstart phase in their plan. And it would go first to high-risk health workers in healthcare facilities. And that includes long-term care, people working in the ERs, people working in, ICUs and in the hospital, clinics, places like that. And so that would be the first. And then first responders, and then also people of all ages who have a comorbid condition that puts them at extremely high risk for a negative health outcome. And then older Americans who are living in congregate settings or overcrowded settings. So this could be people who are living in long-term care situations or people who just live in a multi-generational household. We have also then phase 2, and again, that would be, after this initial probably December, January, then we will start seeing vaccine come in for critical risk workers. These are workers who are in industries which are both essential functioning, and we learned that at the beginning, like what is an essential job, for example, and also those at highest risk of exposure. So those would be the people that are dealing with the public in their jobs or in situations where they have to be closer to other people. Also, teachers and school staff would be in phase 2, people of all ages with comorbid and underlying conditions, all older adults who were not vaccinated in phase 1, people living in homeless shelters, group homes for individuals with, physical, mental, or developmental disabilities, people in recovery. So those would be treatment centers, places like that. Also, people in prisons, jails, detention centers, basically all of the congregate living facilities that exist would be in 2. And then in phase 3, that would be young adults and children. And this, we're looking, it's hard to know exactly, but probably, later spring. Young adults, children, workers in industry essential to functioning, but that were not, so basically everybody who wasn't in phase 1 or 2, but who work in essential functions. And then in phase 4, that would be anyone in the US who has not received the vaccine yet. So that's kind of the, overarching plan of it. But that, as they say, the devil's in the details. So we just have to see how many, every single thing that we do is contingent upon how many vaccines we receive and the supplies we receive. And that's going to be the limiting factor, basically, on every stage of this. How many vaccines are we getting? And then where will they most effectively be deployed?
Thank you for outlining that. But at this point, states don't know the order or the rollout of the vaccinations, who's getting it when, and how many doses they'll be getting up front?
We do. We know what we've been told, and it's already changed 3 times. So I am in no way going to give a number. Let's just say it's a pretty small number. We have 230 some thousand in our county, and it is just a tiny fraction of that number. But we do expect to, as soon as it starts getting, the different ones start getting moved off the production line, as soon as they're approved and everything, we plan on getting them in people's arms the day they get here. Initially, public health won't even be doing any of the vaccination. It'll probably be going directly to the health facilities where their staff will vaccinate their high-risk staff.
It is amazing that people are clamoring and that people want the vaccination. Have you gotten the other side of it yet? People that are already resistant to getting an unproven vaccine or any pushback to this vaccination yet?
Well, we work in our community all the time with people who refused vaccination with extremely highly effective and proven safe over decades and decades of vaccination. So yes, we certainly expect that. And this is one of those things where it's going to be available. Somebody hesitates, it's going to be moved on to the next person, would be my guess, because there are plenty of people who would like to get this vaccine.
I want to pivot for a second towards Christmas and talk about not just gathering, but gathering in religious congregations. Just now, the US Supreme Court decided in a 5-4 decision that we could have gatherings in churches and mosques and synagogues of more than 10, more than 25. Is this going to be a public health nightmare as we head into Christmas, a holiday that people like to congregate in religious organizations?
It absolutely will be for some places. In Champaign-Urbana and Champaign County, we have had a lot of the faith-based community working really closely with us since, February and March on this. And so a lot of them are still doing things remotely or in other ways that do not put anyone at risk. But I can assure you, if places open up and try to do business as usual or get too many people in there, we've already seen this before in other states. We've seen massive, super spreader events coming from these. So it's up to individuals, to decide whether they go if their place is open or not. But, it's not a good idea. And I don't look for a ton of places in Champaign-Urbana and the county to do that. There have been some who have opened with greatly reduced capacity. But yeah, can you do it? Yes, meaning that, public health's not going to come in there and stop them from doing it. Is it a good idea? Absolutely not. Nothing has changed. And we have to, again, double down on our efforts to get the correct information out there. And for the people who are in charge of making these decisions at the faith-based organizations, they need to really consider the safety of their congregations, because it's going to get down to, and they know this, if you open it, some people will believe it's safe. So even if it isn't. So it's a lot of responsibility on the people who make these decisions at the individual faith-based level. But it's still not safe. We're getting toward the vaccine. We have to be vigilant. We have to keep doing what we've been doing to save as many lives as possible and to keep our healthcare system from becoming overwhelmed.
So now we're in that period between Thanksgiving and Christmas. Everyone, Dr. Birx, Dr. Fauci said, who traveled and who did not listen to the CDC should get tested, should assume that somebody they congregated with had the infection. We don't want to overwhelm the healthcare system. If we have another spike at the end of this week and next week, as you mentioned, will we be able to recover? And will that be enough before Christmas, before we know people are going to congregate again?
That's a good question. As far as people getting the cases and getting over it, assuming that they have a mild case, then they will be over it. Yes. Will they have passed it on to multiple people and we have secondary and tertiary spread from that? Probably. And because people who have traveled and have done things that they know is not safe are not quarantining right now. I guarantee you the vast majority. But the people who, it is very likely that you could get somebody that is infected on Thanksgiving and is still hospitalized at Christmas, Hanukkah, and the winter holidays. That's quite possible.
My mom's best friend, finally it hits close to home. She just got out of the hospital. She was at Carl with COVID, had respiratory issues. She and her husband both had it, and now they declare that they are COVID free and they are fine for 6 months and they can have people come over and visit them. He is a doctor. Can you please dispel that myth that you can't see people even if you have antibodies?
Well, yes. So even when we're vaccinated and stuff, we're still going to need to be following the masking and the distancing procedures until we know exactly where this is going, how long immunity lasts, et cetera. I don't know where on earth they got the 6 months. At no point have I seen anything that says that. There is some that say if you have been infected and you're still testing positive, unless you test positive after 90 days, that doesn't count as another case. But the one thing we don't know is what damage may have been done to individuals who have been already infected. So in general, it's a good idea for them not to be around other people, whether it's COVID or influenza or any of the other viruses that go around in winter. I don't think that they're going to want another assault on their respiratory system.
Last question before I let you go. If I'm exposed to somebody who has the virus for 5 minutes versus 30 minutes to 2 hours at a family gathering, does it indicate that I will be sicker, or is there a viral load that will indicate if you will be sicker?
That is a really good question. And there are all kinds of things about that being spread. And time is one of the factors, distance is a factor, and masking is a factor. And all those things lower your risk factor. And there have been some studies showing that people who are wearing masks are actually, it is protective to them. So even if they do get it, they're not getting, like you said, as large of a dose of, breathing in the virus.
Before I let you go, can you just give us some words of advice, words of wisdom, reminders of how to get through the next month healthy?
Mm-hmm. for the most of you, keep doing what you've been doing. Keep your masks on, keep your hands washed, stay distanced away from people. And, testing is still available out there if you'd like to go get tested. If you are out and you're shopping or anything, just make sure that you're keeping away from other people. And try to just hang on, because we do have a light at the end of the tunnel now. We have vaccine coming, which is a wonderful thing, but we really need to make sure that everyone gets to the end of this with us. So that means that we all need to really double down on what we've been doing. So please keep doing what you're doing. If you're doing it right.
Well, when you say get to the end,
get on board.
No, and whatever you say, this community's been good at listening to that. So thank you for your leadership. Thank you to our producer, Jason Liggett. As soon as this is over, the three of us are going to sit down for the biggest face-to-face meal that we've ever eaten. I want to thank Urbana Mayor Diane Marlin. Thank you for letting us continue to do this with UPTV. But Julie Pryde, I'm glad that we've made it through one of the big holidays. Let's just brace ourselves. Thank you for the light at the end of the tunnel with the CU PhD. Thank you again, Julie Pryde, for everything you do.